Hello, beautiful people. Welcome back to Ask Me About DT. This is Nadia Mills. I am a lymphedema and pelvic floor physical therapist. Thank you so much for checking out this podcast. We are coming down to the end of a 4 to 5 part series talking about different things that cause pelvic floor weakness. This is our final point. It's been really interesting. Thank you guys so much for all your feedback. I'm glad that we're taking the opportunity to find out what daily interactions and activities affect our pelvic floor. There is so much to demystify about the pelvic floor, and I am so glad that you guys are giving me the opportunity to do that. Remember, share this podcast with your friends. Everybody really needs to know this information. Make sure you like, subscribe, share. Also, you can check out my videos over on YouTube at DTPT Wellness. So let's get into this. So this is the last of the 8 causes of pelvic floor weakness. And like I said, this is not an exhaustive list, but these are like the top 8 contenders when it comes to their daily interactions and things that affect our pelvic floor function and its strength. So the last thing on my list is, and I'm putting them together, diseases and injury. So, it's obvious that an injury to the pelvic floor can cause weakness or damage, just like injuring any other part of your body. However, what you may not be aware of is that an injury to another part of your body can actually cause the pelvic floor to become weak. And when I say that, I am speaking mostly specifically about your back, your stomach, and your hips. The reason these areas get affected is because they all work together. Your pelvic floor is a part of your core, and your core is made up of basically your diaphragm, which is your breathing muscle, your abdominal muscles, which is the front part of your core, your back muscles, which is the back part of your core. The sides are covered by the abdominal muscles as well. You have your obliques and you have your transverse abdominal muscle. And the bottom of what we call our core is our pelvic floor. So all of these muscle groups work together as a unit to help to support your body. And so if there is damage to one or multiple groups, even though it's not directly to the pelvic floor, it can weaken your pelvic floor. So that is injury related to muscles around it. Now, what about disease? Pelvic floor is so integrated into your everyday function. So diseases outside of the pelvic floor, for example, not completely outside, but for example, gastrointestinal diseases. So diseases of your digestive tract, diseases affecting your lungs. One of the things that stands out right now is a smoker's cough. A lot of people don't realize or don't understand that having a chronic cough, so not necessarily just from smoking, but anything that creates a chronic cough can also cause pelvic floor dysfunction. Because like I mentioned, your diaphragm, which is your breathing muscle, is affected whenever you cough, and that affects your pelvic floor. And if you cough chronically, you can fatigue the pelvic floor muscles. Also, you can put them in spasm or you can make them tight, and that can lead to pelvic floor weakness. So, like I said, your pelvic floor does not live in isolation. It is related to everything. And so everything can affect your pelvic floor. So surgeries also, let's talk about, for example, your knees. So your knees are nowhere near your pelvic floor. But if you have a knee surgery, or say you have severe arthritis in your knees, the body mechanics that you need to move from your knees to your hips to your back, all of that involves the pelvic floor. And so I have had clients who have had incontinence issues because they had arthritis in their knee. And because of that, they would strain their pelvic floor and end up having issues with incontinence. So I'm telling you, this thing, your pelvic floor, it's involved with everything. So let's go more specifically, because the other thing that we may not be aware of is that sometimes we're trying to fix problems elsewhere, and we actually kind of generate challenges and problems in our pelvic floor. And one of the examples of that is in medications that we take. There are a lot of medications that we take for other conditions that end up affecting the pelvic floor. And my friend, my favorite pelvic floor topic, which I mentioned probably like in the first one in the series, is constipation. And so there are a lot of medications that we take to treat other things that can actually lead to constipation. Constipation leads to pushing and straining the pelvic floor muscles, which can lead to incontinence, which can also lead to prolapse. So I think my next podcast is going to be all about constipation because it is so important and so key to a lot of pelvic floor dysfunction. So let's break down a couple of medications that you might be taking for other conditions, and you need to be aware of their effects on the pelvic floor, right? Doesn't mean that you don't take the medication, but if you end up seeing related constipation issues or challenges with your pelvic floor, it would be advisable to consult with a pelvic floor therapist, also to consult with your prescribing doctor and making them aware of the symptoms that you're experiencing. So, number one, opioid pain meds. Yes, we are very aware that pain medication can lead to constipation. And so people who are using opioid pain medicines have to be very careful and mindful that if they're having issues with constipation, that is something that they need to look into. And like I said, I think everybody should consult with pelvic floor therapy because of how important it is in our overall function. And so people who are on pain meds should have some awareness that pain meds do affect the pelvic floor. And a lot of times it affects it through having to deal with the symptoms of constipation. I wanted to kind of back up a little bit. I think I mentioned surgery in the abdominal area and so forth before, but I also want to link it into this. If you've ever had a surgery, and I assume it's still the same way, they will not let you leave the hospital until you've had a bowel movement. I'm telling you, pelvic floor function is critical to your overall life. If you went into the hospital and you had eye surgery, I'm just assuming, but again, if you haven't had a bowel movement, you will not leave that hospital until you've had a bowel movement because they want to make sure that all those functions are coming back online before they release you. Because telling you constipation, oh my gosh, constipation is such a challenge and it can affect so many functions in your body. And so surgeries in the abdomen, in any other part of the body, can affect how your bowels work. And that is one of the key things that they monitor and check on when you are having surgeries. All right, so back to the medications. So opioid medications are, for example, things like morphine, oxycodone, tramadol, fentanyl, Dilaudid. So these are pretty heavy pain meds. And so there's a significant component, and again, not for everyone, but there's a significant component of constipation that is linked to opioid use. Alternatively, if you don't take opioids for pain management, a lot of times people will take NSAIDs. So that is stuff like your ibuprofen, your Advil, your Motrin, naproxen, sorry, that's in your Aleve. So even non-steroidal anti-inflammatory drugs, NSAIDs, can also have an effect on constipation. So so even over-the-counter drugs, you have to monitor your body's response if you're tending to take pain medication, whether it is opioid or NSAIDs. Another class of medication that affects your pelvic functions, and like I said, most of these are related to constipation challenges, are blood pressure medications. So some blood pressure medications can cause pelvic floor challenges with constipation. Also, antidepressants. So not all antidepressants, and again, not all medications. Each medication has its side effects. Make sure that you are reading all of your information for your medications and potential side effects so that if any of them show up, you are aware of the potential connection to the medications that you're taking. Now, this one's not a medication. This is a supplement. So sometimes we have a need to supplement iron. Iron, again, is something that we are very familiar with in terms of causing constipation. So it doesn't mean that you shouldn't take iron. It just means you have to be aware of the potential effects that it has on pelvic floor, causing constipation, which in turn can lead to pelvic floor weakness and straining. Also, not so well-known medications that can affect the pelvic floor are meds that you take for nausea, antihistamines, and let's put it this way, antihistamines, all of these are linked to constipation, but for antihistamines, there's another factor that you need to be aware of, vaginal dryness. So sometimes people have allergies and they need to take antihistamines, and at the same time, they may notice that they have some vaginal dryness or, decreased lubrication. So antihistamines pretty much dry you up. And so if you're taking antihistamines and you're also experiencing vaginal dryness not linked to anything else, it potentially is the effect of the antihistamine. And be liberal with the use of lubrication to keep those tissues from getting irritated. And also monitor how you feel when you are not taking the antihistamines. If you think that it is beyond just the effect or the side effect of the antihistamine, please follow up with your provider. The sooner you address something, the better the outcomes are. Don't ever delay. If you notice something that is unusual, please follow up so that it can be taken care of sooner than later, so that you may have a comfortable and quite pleasant experience when you have to do anything involving the pelvic floor. Now, here's another one that's a little bit mind-blowing. Medications that are actually for pelvic floor dysfunction can sometimes trigger pelvic floor dysfunction. And in this case, medications that are used for overactive bladder can also cause or contribute to symptoms with constipation. So yes, we are sometimes trying to cure one thing, but sometimes we end up with challenges elsewhere. So it's really important, super important to read side effects and all the information that you know about your medication so that if anything is happening, you can be aware of what the potential interactions are and side effects. A couple more biggies in this area of disease and injury is in men's health, we have prostate surgery. So a lot of times when men have a prostatectomy, they end up having challenges with incontinence. Depending on the type of surgery they have, one of the sphincters, the muscle that helps to close off the valve that prevents urine from coming out, one of the sphincters is sometimes damaged or removed with the surgery. And so sometimes that can lead to incontinence challenges. However, pelvic floor therapists, we deal with that. It's very important also, if you are going through treatment for prostate cancer, it's very important and beneficial to consult with a pelvic floor therapist before the procedure, because in that way you actually know what muscles you're trying to activate. Because if you have a surgery and you've never engaged your pelvic floor before, it's sometimes very challenging to be aware and know what muscles you need to activate after you've had the surgical intervention. And as I mentioned before, when there are surgical interventions anywhere in your body tends to shut down certain muscles to try to protect the area. So if you have never contracted your pelvic floor or never tried to relax your pelvic floor before surgery, sometimes it's very difficult to activate it and become connected to it afterwards because you don't know what the sensation is. And sometimes you could have muscle inhibition taking place, which makes it even more challenging. Similarly, for abdominal surgeries for women, you have hysterectomies and C-sections. I mentioned before earlier in the birthing category, anytime there's a surgery, your body does the same thing. It tries to protect the area. It is not aware that you are intentionally doing a surgery. It just knows that there's an injury and it tries to protect it. Or you might have scar tissue that causes pressure around your bladder or your lower abdomen, or just muscle imbalance. Sometimes you might have a hip imbalance. So there are a lot of things that can happen around surgeries that are directly related to the surgery itself, or just the response of the body afterwards as it's trying to protect the area. And finally, number 8. So number 8 is also a very common one, or one that people think of commonly, is that aging causes pelvic floor dysfunction. That's not really the truth. To be honest, as we all age, we become less active. We lose muscle, and we lose muscle all over, not just in our pelvic floor, but all over, because we are less active. And so I have a lot of clients that come in and is like, I'm old, what can I do now? It's too late. It's never too late. So once you are able to contract your muscles voluntarily, once you can learn, you can strengthen your pelvic floor, and you can help to correct some pelvic floor weakness and manage any sort of pelvic floor dysfunction, regardless of your age. Regardless. I have had 80-year-olds learn how to control their pelvic floor muscles and correct incontinence after 50 years of being incontinent. So really, pelvic floor is, I don't know, I want to think of it as magic. Really, it can correct some things that you have been dealing with for years, and in very simple techniques, So just be open to learning. Come on in, contact your pelvic floor therapist and learn what you need to learn. And also have a generally active lifestyle. Try as best you can. Guys, start an active lifestyle. Start, whatever is in your capability, walking, dancing, gardening. Stay active. Keep that muscle tone that you have. Also do some resistive training so that you can maintain and grow muscle, so that as you get older, you don't succumb to what we call old age. So really, this whole thing about aging, it's really less activity and less focus on retaining or growing muscle. So you can have a healthy older life as long as you stay active, you eat well, you stay within supportive groups, have good friends and family circles, maintain a hobby, and exercise. So that's it. We have gone through the 8 main things that can contribute to pelvic floor weakness. I'm going to do a quick recap from 1 to 8. Number 1 on the list, we have diet. Number 2, toileting habits. Number 3, body mechanics. Number 4, excessive weight, carrying excessive weight or obesity. Number 5, birthing. Number 6, stress, emotional and lifestyle management. Number 7, disease and injury. And number 8, age-related changes in hormones and muscles. Thank you guys so much for sticking through all of these little tidbits. I hope that you've learned something, and please share it with friends and family. Share it with strangers. This is stuff that we all need to learn. So thank you as we continue on this journey to learn more about our pelvic floors and how integrated it is into our everyday life and everyday function. And more importantly, how easy it is to take care of it if we have the correct knowledge. So continue to listen into the podcast. I will be talking about constipation next. I am so excited. Yes, I love constipation. Not having it, but taking care of it. So that's going to be our next topic. So I hope you guys will join me for that. Thank you so much for subscribing. Thank you so much for giving a thumbs up, leaving your comments and your questions. If you would love to have a consultation with me, I do provide free consultations. So just check the information in the podcast information below. Click the link and set up an appointment. I'd love to talk to you and we can share more about pelvic floor and pelvic floor health. Until next time, always love yourself, love others, and bring kindness to the world. Bye-bye.